Thank you to the Moving the Needle corporate sponsors, Home Infusion Options and Metro Infusion Center, and our exhibitors, Takeda, Janssen, and Bristol-Myers Squibb. You share our mission of advancing patient care and make events like this and our grant making possible.
So now it's really my pleasure to introduce my colleagues, Dr. Verma and Dr. Williams, who are here to teach us a little bit about celiac disease and something called brain fog. So at the end of a long day on a Wednesday, maybe some of you are feeling like you have brain fog, or perhaps you've had too many glasses of wine, but it is a serious problem and they're trying to figure it out. So I'm going to hand this off to my colleagues to my left. Dr. Verma is the Chief of Pediatric Gastroenterology, Hepatology, and Nutrition, and my good friend. And she and I have regular calls to compare notes between the pediatric faculty and the adult faculty. And Dr. Williams is a clinical research coordinator who's been working with her, and together they've been trying to tackle this very difficult problem. So I'll let you guys take it from here.
Thank you. So we have a few minutes. We're going to talk at the speed of lightning here. Dr. Williams, I have to say, she's one of our research assistants, but actually going into starting her residency soon. And we also have another person who's part of the team, and Dr. Kleinhans, who's one of our fellows. She's on vacation, and we couldn't pull her from that, so I'm standing in. So celiac disease. So just like Dr. Rubin mentioned, with inflammatory bowel disease, it's something that is seen worldwide. At one time, it was thought that celiac disease is only seen in the French Canadian and the Irish, and that's not true. It really is seen in any population. And in fact, the highest incidence has been in the sub-Saharan Africa. So people would wonder why. So it's something that needs to be thought of at any time. It is an autoimmune disease, just like inflammatory bowel disease. It's also genetic. So a little bit more advanced than inflammatory bowel disease. And I'm trying to look at Dr. Rubin just to say that celiac disease is a little more advanced, is where we do know some of the HLA genes that are associated with that. So in order for someone to have celiac disease, you need to have these specific alleles, and they're called HLA DQ2 and DQ3. So and DQ8, and if on a Wednesday evening you're feeling a little woozy, then come, we'll get the blood test done. You have to have the genes, you have to eat gluten, and then there's something else that happens, and that's where Dr. Chang will come in with the microbiome and things like that, which we don't know right now exactly what the trigger is, but something triggers, and it can really happen at any age. It can happen in a 2-year-old, and it can happen in a 90-year-old, and the shock that a 90-year-old gets is that they cannot eat gluten is rough. So gluten is wheat, rye, barley. You cannot eat half of the stuff that was there today, but some of the stuff you can have the veggies. So you cannot eat wheat, rye, and barley. It is associated with other autoimmune diseases, and we know the most common autoimmune disease associated with celiac is thyroid disease. Bringing in inflammatory bowel disease, there was a study done recently, a meta-analysis, which showed that people with Crohn's disease have a 4-fold increase of developing celiac disease as well. So Dr. Cohen, think about that. Celiac panel. And people who have celiac disease have a 10-fold increase as well of developing Crohn's disease, which we need to remember as gastroenterologists as well. So there's a lot of association with other autoimmune diseases that we need to keep thinking about. The most common symptoms that people know is abdominal pain, diarrhea, that's sort of traditional. But a lot of people with celiac disease will complain of this thing called brain fog. So they just don't feel right. They eat gluten and they don't feel right. And nobody believes them because, you don't feel right, could be 100 other things. Depression, anxiety, learning disabilities, all have been associated with celiac disease. And unfortunately, we don't have a test to tell us whether it is really associated with celiac and what's the long-term prognosis. So we came begging for some money. And we were really lucky that GERF funded us, and we have the study going. And
thank you. And so the objective of the study is to take a look at the brain fog symptoms, the celiac antibody levels, and the brain activity in kids who are newly diagnosed with celiac disease prior to the initiation of a gluten-free diet, and to follow those components after the initiation of a gluten-free diet for a total of about 12 months. And what is really exciting is we are using the functional MRI, and this is uncharted waters. So how it works is that when the brain is processing a task, there is increased blood flow, and that causes the brain to light up. If there is a delay in processing these tasks, then we expect to see decrease in blood flow. And so we expect to have dimmer findings on the MRI. And so correlating these changes in the blood flow along with the brain waves on the EEG and their antibody levels and the cognitive tests, we hope to be able to understand how these brain fog symptoms develop and how they improve on a gluten-free diet.
And this has not been studied. We're wrapping up in 1 second. So this has not been studied before. It's not been proven. So we are uncharted territories to really see, is this related? Can we pick it up on a functional MRI? Can we pick it up on an EEG besides doing our blood tests and doing a psych analysis as well? So hopefully if someone has these symptoms, they have celiac disease, we could tell them, let's do a functional MRI. We can tell you, and also not only just telling them, but also once we put them on the treatment, how long will it take for you on a gluten-free diet? Because that's the first question everyone says, how long am I going to feel sick? So with this, we have not just GI, but we have our radiologists with nuclear radiologists, we have psychologists, we have psychiatry, we have neurology. So we really have a lot of people excited about this study, and I don't think we could have gone anywhere else. So thank you so much for giving us this funding so we can at least get some results, and then we can go expand to the NIH, we hope. So thank you for listening. Sorry, going over time.